little old ladies with broken hips, because they are the survivor. they're the best.
We just clean up on aisle 4. Zach just lost his soda. All right.
Welcome back into Bufnagle, the podcast. I'm Zach, and always I'm joined by Rafe. Rafe, how are we doing today?
Hey, Zach, I am fantastic. It is an interesting thing. Again, we have done this once before, where we were actually in the same room. So for regular listeners, you may not know that being in separate locations actually keeps Zach and I from getting at each other's throats. You know, and there's no.
Well, now I can throw stuff at you.
That's right, but there will be no fisticuffs when we're in separate rooms. We cannot make that guarantee today. We never know what may break out, but there could be high fives. There could be. I doubt there will be punches thrown, but you never know where this may go. So, no, I'm great, Zach. It's good to have you guys home, and it's good to be in the same room because it creates a little different vibe for the show today. I want to make sure I tell everybody, of course, we are Bufnagle at bufnagle.com. We are on Spotify. We're on Twitter. We are on Amazon Music. And recently we just came onto the Apple podcast machine. So we're
now part of the Apple podcast family.
Right. So what we really need, okay, here you go. Because we get these letters. How can I help you? All right. That's what people keep saying. Here's how you can help us. 5-star reviews. So give us a 5-star review on the Apple podcast machine. You can even say something nice on there if you would like. If you can't say something nice, then please write down the thing you want to say that's nasty, put it on a sheet of paper, and then fold it up real small and throw it in the fire. Right. So do that for us. But otherwise, give us a 5-star review. That really helps us out with the Apple podcast thing. And I do need to mention, Zach, we have a sponsor.
We have a friend.
Yes, at this week, again, we are sponsored by the Buck and Bowl Boutique. And we are looking right here at the Buck and Bowl Boutique online store on Facebook. You can search for Buck and Bowl Boutique. You also find our friend Kayla on the Etsy machine. But all sorts of fun stuff to make your house and your life prettier. And those of us who are guys, we've mentioned this before, we tend to decorate with things like antlers and maps, right? And she decorates with pretty things. So if there's something, if you're a young lady that has guys in your life, then you want to go over here. She makes earrings and placemats and centerpieces and all sorts of really cool stuff for your house. Most of them are unique, and that's kind of a nice thing. And support your small business. Kayla is one of these small businesses. Look her up at Buck and Bowl Boutique and tell her that we sent you, and you'll get 15% off. Say, the Bufnaglers made me come.
We're fans of the Buff.
Yes, you can say we're fans of the Buff, and that will work too. Yeah. So make sure you mention that and go to Buck and Bowl Boutique.
That sounds fantastic, Rafe. So today we're bringing on a close relative of ours and also another fan of the Buff, Bennett, who is my cousin, your nephew, and he's going to be talking to us today about some physical therapy things, medicine as a whole, and the kind of recovery in sports as a whole overarching thing, and the kind of some fun things he's learned along the way. So Bennett, how about you tell us a little bit about yourself?
Well, thanks, Zach. I'm Bennett. I'm, I guess, Zach's cousin and Rafe's nephew. And
yeah, we don't always do, it's like I just know him as, it's Bennett. And he's like, hey, it's Rafe. And it's like, no, it's Uncle Rafe. It's his nephew Bennett.
It's Dr. Dude. Wait.
Yeah, yes. So, but you're in grad school at Duke.
Yes. I've just finished my first semester at Duke. Got anatomy and physiology done in grad school, which is normally the big hairy beast, but it is, it's done. So,
all right. So grad school in physical therapy is a 3-year program.
Yes.
How's it work?
It's 2 years of didactic learning, which is in the classroom lectures. And then you have a year of clinicals, and there are 3 to 4 month rotations throughout your last year. And you can get sent to Salt Lake City, Texas, California. You can get sent wherever PTs are needed, and you also get to decide if you want to do, let's say, pediatrics or neuro, inpatient, outpatient rehab. It's
so do you pick that thing or
does the thing pick you?
Yeah, that's right. Do you wear like the PT sorting hat, and it tells you have to go to Gryffindor or something?
I have noticed that there are, just like I was in band in middle school and part of high school, and there was always personalities for each section. I know the trombones were the goofy guys, and always having fun, but definitely different aspects of PT draw different people. Right now I've spent a lot of time with neuro patients, and I find strokes and injuries to the brain can just be very interesting and fun to deal with and work with those people.
All right. So no, I've never gone to PT. Zach, you've had a PT.
I've done PT, I've done chiropractic, I've done all of the things that avoid the traditional medicine approach, I feel like.
Just now, is that because you're not a believer in that, or just it's been easier to get into the system?
I think a combination of things. For me, it was I have this injury, I know what it is, and there's kind of that recovery treatment procedure that in PT and chiropractic and stabbing needles in your feet and cupping and those type of things that has been beneficial for me. Not saying that traditional medicine and antibiotics, but like it's an injury. It's how your bones and muscles and skeleton kind of work together. And Ben, I know you can talk more about this, but you're treating that as opposed to like an infection in my tummy. Mm-hmm. Like you can't really help with an infection in my tummy, but you can help with, getting my shoulder to be able to lift things above my head and be able to work out and continue.
And that's another thing that I was interested in PT was because it's not invasive. There's not a procedure you have to go through. It's all on how you exercise pretty much and how powerful that treatment can actually be without going inside the body.
Yeah. So now you said yesterday when we were doing our pre-production meeting, you said that there's this added, the goal of physical therapy is to
return prior functioning, or I guess goals are a big thing. So having your patients be able to reach the goals that they set for themselves.
Right. So there's the old joke is that, the guy injures his hand and he says, "Doc, when I get better, we'll be able to play the piano." And he goes, "Well, could you play the piano before?" Right. I mean, so that's the question. Exactly. Right. Your job then is to propel these people toward their goal and help them reach them if they're tangible.
Yeah. So, and maybe another way is you put yourself in a position to help the patient be able to do something successfully in the future.
Yes. And that can change drastically just based on where the PT is and where they're practicing. For example, if you're inpatient rehab, your goal for the patient is or inpatient acute care, your goal for the patient is to not return them to their prior functioning, but to get them out of a medical need rather and into a rehab need. And that's somewhat the purpose of a hospital. You're not going to get good rehab at a hospital. You'll get great medicine, but it's trying to fix you up so you can now prepare yourself for rehab.
So Zach, you've done some PT work, and Bennett, you're going to do PT work. So that's mostly outpatient. Is that associated with clinics and hospitals? What's the structure for how that works?
Like when you have like a PT practice per se, what does that look like? Is that kind of what we're getting at?
That's the thing. So I've really gravitated towards inpatient rehab. So the outpatient world is somewhat kind of foreign to me. But I have shadowed for a few hours in outpatient clinics, and you see a lot of ACL repairs. You see a lot of older individuals in the morning coming in with knee replacements and hip replacements. And those are I think the most fun patients to have is little old ladies with broken hips, because they are the survivor. They're the best.
We just clean up on aisle 4. Zach just lost his soda. All right. So I'm sorry. So you said you like to work with the little ladies.
Yes.
They make better progress? How does that?
They are tough. Like, they never cry. They never complain. You just ask them to do an exercise and they will do it. And because you get somebody that's my age, 20 years old, and they broke their leg somewhere. They will whine and complain about the pain and expect it to be pain-free. But the little old ladies, I don't know.
They're troopers.
They're troopers. Yeah.
Well, okay, I think that's part of the thing. So I'm older than you guys are.
Mhm.
I would hope so.
It probably doesn't show on the basketball court when we're out there together. But no, I'm older, and I have ailments that I'm facing all the time. My shoulder is not quite up to snuff. I pulled a muscle lifting weights the other day. I have this thing in my foot that's wacky, and the mentality, I think, as when you're younger, I think the mentality is just give me something to make it better. To give me a pill, go in there, cut it out, sew it up, make it so I want to go back to where I was. But that's probably not a reasonable goal in all those situations. You have to help them meet their goals, but some of those goals aren't reasonable.
Exactly. And some of those goals don't fit with their current lifestyle. So it's part of PT is also changing the bad habits and reinstating better ones. So
could some of those bad habits be, Rafe, you're talking about like lifting. I did this thing while lifting. I injured my shoulder while playing basketball. Maybe it comes to the fact that idea of like maybe an overtraining of a guy who's 22 years old. He's in the weight room six times a week, twice a day type thing. And he's pushing his body to really good limits. He's really strong. He's physically fit, but also at the same time, his body's probably broken down on some level.
Exactly.
Right?
Yeah. And that's a big part of it is, I guess, knowing your patient. And again, back to the goals is specifying the goals for the patient's life. If someone's going hard, just like the little old lady, you won't be able to do the same exact exercises and treatment with her as the person that you just explained. But
okay, so let me ask. I'm going to be a devil's advocate.
Sure.
Okay, so I let's say I hurt my shoulder and I get shoulder surgery. Get my shoulder fixed up. My shoulder surgery. All right, so I get my shoulder fixed up.
So you go visit Brian, the anesthesiologist, knocks you out.
Yeah, it knocks me out. Somebody
takes care of it,
sews it back out, and
Bennett.
then I go see Bennett. Okay,
yep.
And then I guess I'm trying to say, why do we need you to help out? Is it no? I know the answers because I go to a guy and I work out with a guy when I could work out at home because I just don't have it's easier to work out with. Mm-hmm. How much of it is that, and how much of it is you can do things for them that they can't do on their own?
Well, there's the patient-therapist relationship, which in and of itself is just having someone there to motivate you and push you is, I think, half the battle. And the other part is just like someone that grew up not playing any organized sports or with a team that has organized exercises and workouts. If you go into a gym, you don't know what to do with the dumbbell, and you don't know what the correct position is for a squat and
some those things matter though, right?
Yes.
Because on the surface you're like, well, how can it really matter whether I lift it like this or I lift it like that? But it does matter
because I'm lifting it.
Right. Well, at some level, you can get in pretty good shape working the summer at the farm lifting hay bales, right? You can do that, but if you are injured and you're rehabbing, it matters how you use those muscles.
Exercise you use in rehab.
Well, yeah. So you can hurt things. You can do more harm than good if you're not doing it right. Is that correct?
Yeah, and that's the other thing is you don't want to, like you said, overtrain. You're trying to get stronger, but you're tearing your body down so much that it needs more time to recoup. And
so let me ask you that, because you guys both work out pretty well. You work out very regularly, and you work out. I haven't seen Bennett in a while. Bennett's working out, all right? So,
but I'm not. Is that what you're trying to say?
Well, no. You look like you always. But I've seen you a lot. So I remember in high school being a swimmer, and we worked out every morning and every afternoon, and every day except for Sunday. I think we worked out. And at some point I'm like, okay, how many times could you work out versus how many times should you work out? And at what point is it it's not beneficial for you? Is there, and what are the risks?
That's actually like the prime question that's trying to be answered right now with a lot of articles and
Good question.
Yeah, I've probably in the past week, I've seen 2 articles saying, should you do high intensity reps and leave nothing in the tank and do this every day? Or should you leave 2 reps in the tank with every workout that you do so you have energy to do the same exercise with the same intensity, with the same good technique tomorrow? So again, back to overtraining. If you overtrain on Monday, you won't be able to train on Tuesday. You have to wait till Wednesday.
Well, and okay, so that's so we do. I work Monday, Wednesday, Friday. I mean, I work out Monday, Wednesday, Friday because that's when the gym guy does that stuff.
Mm-hmm.
But there are guys that are like shoulder day and leg day and tummy day, and all right. So then they kind of rotate them
Brain
through. Brain day. I just spend a lot of time doing brain day. But if you're doing that, if you're relaxing certain muscle groups and using other muscle groups, then that should count as the off time, right? I mean,
that's a way that people do it. They put it into push-pull days where they'll do chest. They'll do chest and shoulders on one day, or chest and tris on one day, and then back and bis on the other. And then they'll alternate and throw in a leg day in between. And I've seen some workout plans that just get way over the top, and it's just go to the gym and lift weights at some point. But there definitely is a line where you can overtrain, and I think what I've seen with these articles, I think it's more beneficial to do less reps more days in a row than harder reps 3 days a week, if that makes sense.
Yeah, so you don't want to break yourself and then have to recover from the broken. It's better. So I never lifted weights when I was younger. I only started doing that 2-3 years ago, and I used to do a lot more aerobic stuff. I swam and I ran is what I would do. And if you're a swimmer or a runner, you like that or you don't like that, it can be really boring.
Mm-hmm.
I hate it.
And
no, I'm just gonna say,
and I
don't
run.
run.
I mean, and I've come but now that I'm lifting weights, I really like to lift weights. And the reason I like to lift weights is it's a lot easier than running.
Mm-hmm.
I mean, it's like I find it's so much easier to lie there on the bench and crank out the.
Maybe you aren't pushing yourself hard enough.
Well, am I supposed to use the weight? So with the physical therapy thing, I think the way I see it, and I know this probably isn't accurate, I see a lot of like, I guess I'll call it muscle and orthopedic kinds of things, but not as much aerobic stuff. Is that a thing?
That's actually good, because we're learned a lot, or we're taught some things about.
We're learned good stuff there.
He goes to Duke and he's out there,
He sounds like you. All right.
We do. Oh, now I lost my voice.
I was asking about.
Wait, we derail the conversation. We've never done that before.
It never happens that we go off the rails here. All right, so I said aerobics.
That's right.
Like when I was a kid, there was this book that came out, and it shot to the top of the bestseller. It was called Aerobics, and the idea was like, you get aerobic points for running or for swimming or for what bicycle thing. It was the things that get your heart rate up and keep it going. Mm-hmm. And I just find aerobic activity is so much more difficult than just doing, I don't know, anaerobic activity, I guess, is lifting weights and stuff. Is there much focus in PT on the aerobic needs of the recovering patient?
Well, I guess you have to reach a certain aerobic capability in order to do PT, I guess. Okay. Going into inpatient acute care, and there's a patient that is just too medically complex to even work with. I mean, their aerobic capability is not there. But somebody just like the everyday user or everyday person is
body user.
Yeah.
Person is body user.
All of us are just perfectly capable of like going up and down the stairs fine. And I guess the first thing that we do is check vitals, and I guess that would be checking for aerobic capability.
But do you ever see?
Well, isn't checking for vitals just making sure someone's alive? So if they're there, like I hope they're alive, exactly. Or do you deal with a lot of zombies?
But do you deal with patients who are? I just call them health compromised. All right, so patients who are obese or
have an underlying heart condition.
Yeah, they're just so there's something that they're so weak, or they're so like you see this picture of there's an ad out now coming for Christmas, and it's this old. Have you seen this?
I don't watch TV.
Well, you havenent seen it. I saw it on the internet.
Okay? The one that makes you cry.
It's the one that makes you cry. You saw it, right? With the weights, right? With the old guy. Okay, so here's the. Okay, spoiler alert. Okay, you can turn this off.
This is a good PT story.
Well, yeah. So it's the old guy, and he sees he goes to his barn, and he drags out this kettlebell, and he tries to lift it up to his chest, and then lift it out in front of him, and then back. And he's doing that over, and he tries, and he starts, and of course he can't do it. He works for like a year at it, or maybe 3 months or something. And the story is at the end, he is all dressed up for Christmas Day or Christmas night, and he meets his little granddaughter, and he gives his granddaughter the star at the top of the tree, and then lifts his granddaughter up so that she can put it on. And he cries, and it's for something, all right? And I've seen both the German version and the English version, all right? So
of course there's a German version.
Of course, it's all over the internet. But so that guy at the beginning, I guess maybe this is the way to say it. There's not anybody out there that is so broken that they can't get better.
Exactly. And that exercise can help. Exercise is, you stop moving, that's where your problems come in. Is movement is...
You stop moving, you start dying.
Yep, exactly.
Little movement is better than no movement.
Yes.
Yeah, that's true. All right. So I'm gonna switch this. This is great. I can talk about this all day. But people are like, really? And I'm like, no. This okay. You're in grad school, all right, and you went to undergrad, and your degree was in
chemistry.
Okay, so beakers, little plastic
beaker.
Did you ever make like a volcano?
No, that was third grade. I think that was before undergrad.
All right, so you got a chemistry degree.
Did that on Tuesday.
Did that in the garage this morning. So, but so your chemistry degree, and then you apply to grad school, and you're at Duke. But okay. So tell us something that you get to do that people are like, whoa, that's like you were.
I want to do that.
Or maybe you don't want to do that.
Oh yeah.
So I guess the cadaver lab was just my absolute favorite part of going into grad school. I think.
So you did cadaver lab in the last 4 months, right?
Yes.
All right, and you guys have been in-person learning at Duke with lots of nasal swabs for COVID stuff.
Yep.
So tell us about cadaver lab.
So with the COVID thing, our class is broken into groups of about 20, 4 groups of 20. And
so this is the whole program. There's 80 first years.
There's about 90.
90, okay.
But yeah. And we're broken up into A, B, C, D, and then after that it's 1, 2, 3, and we're really small groups. And then I think 3 of us have a cadaver at a time, and we are in the cadaver room for 3 hours to work on a section.
You're cadavering. Okay, so there's so the closest thing I have to this was comparative anatomy lab in college, where we cut up cats and stuff. And so the cadaver room is this big room with fluorescent lights and cold slab tables and bodies on the table and sheets on the bodies. And so you don't just rip off the sheet and start hacking away, right? Right.
That's a good, so first they're in these blue body bags that you have to,
you have to unzip. You have to unload them from the bag.
And then you have to take them out.
Okay, I got it.
So we're degenerating again.
I gotta see where this is. So I want to get a full picture of the unbodying the body bag. So like we see, you see in the TV shows, they go down to the morgue and they identify the bodies. Like, so you had to, the zipper starts at the head.
Well, it's a rectangle bag, and you go zip.
Like a sleeping bag, and it opens. Oh, okay. See,
Yep.
That's the thing. Yep. So you wouldn't have the. Okay, so those of you out there in TV land, you wouldn't have the right picture. You'd have the body bag that zips on yours zipped around the outside, and it opens up, and there's the person in this big Ziploc bag.
Pretty much.
And they're naked.
They're naked. They have a shroud.
A shroud. Them. Okay. And so I'm making a little light of this, right? But there's because it's a thing we don't do in
not
everyday
a lot
life,
of people get to see that,
right? But there's these two competing things. One of them, it's really creepy. And the other thing, it's nearly holy in that these people have given the only thing that they had left when they died. They gave it to you to use and to learn from.
Education and growth and all those other things you like.
All these good things, all this, so in their death, they have given you a component of the adventure of life, right? And so now they have a shroud, and part of that is I guess because I was talking to my brothers who both your dad went through it, and your Uncle Sean went through that, and so, but this whole idea that if you're working on like understanding the hand, it's not like there's this whole body. I mean, you're focused on the hand.
Mm-hmm.
You put drapes and shrouds over the rest of the body. Is that how?
Pretty much. It's pretty much just a flat sheet, the shroud. So
Okay.
you try to have some reverence for the cadaver and keep them covered when you can. But it's when we were doing the arm, we would just have the chest, I guess, covered. And just have the arm pulled off the table.
All right. And so what is this, like an anatomy kind of lesson, like a real anatomy? You get to go in and say, oh, here's my memory of comparative anatomy lab. We're in there and we're looking at the arterial system, right, in the cat, and we're like, well, I don't know which one of these is, they all
look the same.
That's the thing, is you have the drawing, okay, and then you have the real thing, and you're like,
How'd the real thing become this drawing? What artist did you hire to do this?
No, absolutely. And you go cat to cat to cat, and they look different.
Exactly.
And I remember we called Dr. Chantel over, and we said, we're not sure which one of these is the aortic, and this is the whatever, three other arteries, all right? And he says, well, and I remember he kind of crossed his arms, and he stared at it, scratched his beard a little bit, and he goes, all right, here's what we're going to do. We're going to call that one aortic, we're going to call that one splenic, and we're going to call that one whatever. And it was really struck by his attitude of, okay, here's how we're going to make this call, and we're going to
make a model for it to function in.
Not even a model, like, okay, here's the one we're going to call that. This is the one we're going to call that. And I found it really odd because there was so much variation across. Like, the arteries were pretty similar across the cats. The veins were completely different. I mean, it's like once the blood gets out to where it needs to go, it doesn't matter how it gets back, as long as it gets back, right? Mm-hmm. So you're digging in there. So you pull off muscles, and you're looking at tendons and ligaments.
So we started the first day. You have to wrap the hands and the feet and the head in like another, almost like a cheesecloth, and then like plastic bags, almost. But you're trying to keep the extremities moist from drying out, and just so they don't turn to leather, pretty much.
Yeah. Okay.
And then we had to flip the body over, and we started on the back. And the first cut was the weirdest because it's a person.
I'm guessing you haven't cut a lot of human flesh.
No, and
I would hope so.
You put your hands down, and it's cold, but it feels like a human, and it's
a cold human, and it feels like meat.
It
feels like meat.
And that's the weird part. It's the disconnect. You're like, okay, I'm dissecting. This is for class, but this is a person that you're doing it on.
This was somebody's father or somebody's mother. No, did you have a man or a woman?
We had a man, and we had a little note card that came with everybody that said the age, their occupation, and how they died, which I was really thankful for that, because I thought that was a cool insight into.
Well, and then you could know to, like, so if this guy's like this is a mason, and maybe really strong arms,
exactly,
and wrists, or
you could see like kind of the skeleton, the musculature, and all those other fun science words I don't know how to say, like, and develop on his body in some different ways.
And so I think our cadaver ultimately died of cardiac arrest, but had some heart cancer. And so we were excited to get the chest open when that day would come. And then when that day came, we started with the pecs and moved those out of the way. And then we noticed that the whole chest cavity was sunken in, and the ribs had been broken. And that was like, we had all taken a moment, because we realized that like this cadaver, or this man, like didn't have the best like death, because it seemed like he had died from cardiac arrest, and they were trying to resuscitate with CPR. And that's where I was so thankful to see the note card, because it lets you know, like it humbles you and lets you know that this is a person, this is the life that they went through, this is some of the ailments that they had. It was humbling. That's the experience.
And that's, I hear the same thing from anybody who's gone through a cadaver lab. They are always so, and that's exactly what you said. The body feels like meat, but you know it's not. There's this disconnect. You've never touched a body that's been cold. The room is cold, right? I mean, it's not a warm room. You don't want to. You can't have it at 85 degrees.
Yeah, that doesn't feel right.
It is cold, but it's not as cold as I thought. I thought it was going to be like a refrigerator, but it's just like an AC set to like 66 or something. Yeah, it's not too cold.
Wow. And that's right. So this guy obviously had cardiac arrest. They did CPR and broke his ribs doing that. And so when you get in there, it's saws and snippers and stuff to get past the heavy duty skeletal stuff?
Yeah, it's there was one part that was really somewhat interesting and odd to see was our common iliac artery, which is what supplies the blood to the legs.
Yep.
It had a calcification in it, and it was blocked. So the lower limbs of our cadaver didn't receive any of the embalming fluid.
Well, so this guy was working with highly compromised arterial perfusion.
Yes.
Wow.
Yeah, and that was fine for the first 4 weeks, but after week 5 and 6 and 7, I noticed the cadaver lab smell changed.
Really? Okay.
And then when we started getting into the lower extremities and looking at like the glutes and part of the hamstrings, the lower half was not preserved well because it just it did not receive any of the fluid. So it was a fun day because it was interesting.
So how big around? Okay, so we talk about arteries, right? And so this is a thing like, so this was a full grown adult male, right? And the common iliac artery is how big around?
I'd say normal, about maybe a thumb, maybe a thumb and a half.
Thumb and a half, okay.
Yep.
And that whole thing was clogged with?
Well, it had actually, I think, swelled because of the blockage that was in it. And it was then about the size of a large strawberry in one area, and we tried to cut through it with a scissors, but it was like cutting through a very, very thick eggshell. It had just calcified. So.
Oh, and that's going on. So.
And he was walking around with that.
And there are people now who are walking around with similar things. Or
okay, so he had the cardiac arrest. Did you go do the cardiac? Did you find the blockages, and do you do that, or it's not cardiac lab? It's general anatomy.
We did take the heart out, and we got to look through it. I mean, we weren't really able to find anything.
It's like when you're preparing the Christmas turkey, right? You're like, hey, look, here's the parts from, right? Is that what it was?
Somewhat, yeah. And you pull them out and you go, I think this is that, and I think this is this, but it should be over here, but I don't. Yeah, so
it should be over here. The book says it's over here. Well, here's what we're going to do. We're going to call that the iliac crest.
Yeah.
Wow. All right.
Yeah.
All right. So, and that's the end of your. Are you done with that big gross anatomy piece then?
That was the big hairy. So it was 11 credit hour class, and that.
Ooh.
Yeah, and I spent so much time just in that class, but now it's all tied up with a bow and under the Christmas tree.
So, oh, that's great. So, and this man who gave his body for your education, gets buried.
So I had the same question, and also when we were doing these dissections, there's sometimes when you need to remove pieces of fat and fascia to locate certain structures, but when you're pulling these off, you're like, at what point do these pieces become a
trash
person?
Or right? Yeah. Okay.
And there is a container that is underneath the table that any of the pieces or scraps that you pull off. I don't want to call it scraps.
Yeah. I
but any of those pieces you put in a bag so they're together because you want.
Yep.
So I believe my professor had said that the bodies are then taken with all the parts included and then cremated, and then I guess given back to the families. But yeah, it was a gift.
Yeah, well, that's wow, that's an incredible thing. So next semester you have.
I have a few class. The one I'm most excited about is pain science, and I'm
nice
because I know what is pain, and
pain's relative to a person. I think
pain is weakness leaving your body.
Yeah, there's the Marines.
Thanks, football coach. Football coach Rafe coming to a team near you.
Yeah, that's right. Okay, so all right, so you got a pain thing coming up.
Pain science, exercise or prescription of exercise.
Okay.
So a little bit more of. Here's somebody with a hurt shoulder. What do you do with them? Yeah, you know what's wrong with the shoulder, but what's the best things to treat that? What exercise?
How do you give that person with that injury the skills to maintain progress and become effective
and reach
functional
those goals.
fitness and things like that as well?
All right, so All right, so and you have that, and then so summers will be what? Do you intern in the summer? Do you volunteer? You go rake leaves? What happens?
Records podcast.
Yes.
So Duke well, I guess all PT schools, it should be 4 years if you have summers, but they took summers out, so now it's a 1 year less program.
Okay.
So no more summers for me, sadly. But
welcome to the real world.
Yeah. All right. Well, that'll be life. Well, this is you should come back more often. This was
fun.
All right. Well, that is a great story, and I'm looking forward to hearing your continued adventures. What does the Emperor say? We're watching your career with budding interest, or something.
I think that is the quote from episode 1. Wow.
Yeah. So we will watch you from afar. So all good with you? Anything you want to know from us?
Well, thanks again, Zach and Uncle Rafe. It was fun, but I do have to know where the namesake came from.
Yeah, the bufnagle story. We're getting a lot of that, and we're going to do what do we call it? An origin story. An origin story.
The whole history of the bufnagle.
Yeah, it's a longer story than
we need it to be.
For the time being, it's a name, but there's some fortuitous little twists and turns in it, and we'll put that in an episode coming up. I do have to say I want to thank our sponsors again, the Buck and Bull Boutique. Go check them out if you want your life to be more beautiful, and that's a good thing. I want to thank our listeners. That is, there's no reason to do this if nobody's listening. That is right, Zach, right?
I mean, people are listening. I do have
people are listening. So
that.
We appreciate that. Tell your friends. Please tell your friends. That helps us provide more good content if we get ideas of what you would like. And you can find us now on the Apple iTunes.
Wherever podcasts are found.
You know what? That's the way to say it. Wherever podcasts are found. And if you're on Apple, give us a 5-star review. If not, just
tell us what we could do better. So we can have a 5-star review.
If you can't give us a 5-star review, you come on the show and make it so it's a 5-star show. Ooh. All right. So you do that. We'll open the gate for that sort of thing. Bennett, I hope you have a wonderful Christmas.
Thank you.
And Zach, we're working on having a wonderful Christmas. We got some things to do in the workshop here coming up afterwards. A little special treat. And that's where we are. Anything else, Zach?
I think that's it. Bennett, thanks for coming around.
Thank you, guys.
All of the fans of the Buff, we appreciate you, and we'll see you guys next time. Take care.